Hello, everybody. This is Dr. Magarelli here from CNY Fertility, Colorado Springs. Welcome to my broadcast, Facebook Live here, as well as YouTube. And I think I'm on Instagram. I hope I am. I've been trying to be. I know it's been a little bit flaky on the Instagram side. Today's our Q&A, questions and answers. That's what I do on every other Tuesday. Things are going amazing at the office here at CNY Fertility Colorado. We're expanding our staff, as I've said before. We're adding on more nurses. We actually have 2 more nurses joining us. We just hired 4 medical assistants, so we're really high. Hey, Caitlin. Oh, Miss Puffer. Good to see you, my dear. Hey, Elizabeth. Any brand of CoQ10 we should take? Well, Theralogics makes a nice brand of CoQ10. Ubiquinol is another. Hey, Jessica, joining you from the pool. Well, that's pretty nice. I wish I was in a pool somewhere. Hi, Jennifer. On my way there for a retrieval tomorrow. Well, please make sure you come grab me. It'll be myself or Dr. Fink. We'll be doing our retrievals tomorrow. And we kind of, depending on the schedule, you'll get he or I, but definitely say hello. Hi, Sarah. Hey, Brittany. Thank you for joining us. I really appreciate you jumping on, as usual. Again, today is a Q&A session. There was something I wanted to talk about today. Yeah, plans. While people are coming on, hi, Brianna. God's grace, Rochelle, hello. Andrea, we're waiting on our donor eggs in 2 weeks. Fingers crossed. Okay. Mandy, any advice about flying back home on the day of transfer, or it's driving the same day? Now, if you live within 4 to 5 hours, you know what I mean? That's reasonable drive, but we really want you to relax the day of the retrieval, which means go back to the hotel, order food, watch movies. The next day in the afternoon, you could head home. I really like you to rest that day, rest tomorrow. I've had some folks who, and of course, things can get behind and then you're stressed. It's just too much. Hi, Mary. Hi, Pareen. Blessing Maya. Hello there, my dear. So yeah, I would say don't fly home the same day, folks. Hello, sir. Agua Hasdal Fertilidad. Good to see you on that, my friend. And if you have any questions, I'll be happy to do it on Instagram over here. What would HCG be 12 and period be on? Well, why would HCG be 12 and period be on heavy? Urania, not sure what you mean. In other words, you had a positive pregnancy test, but you're getting some bleeding. That's okay. It could be that the pregnancy didn't take and your pregnancy's levels are going down. Beverly, I've heard the standard for starting is 5 or 6 days before FET, but I was only ordered to start 3 days before. And is there a reason for this? I think, Beverly, there's probably a misunderstanding. Talk to the nurses. That doesn't make sense. I had a small piece of retained placenta from my biopsy via hysteroscopy. Should I repeat the biopsy? Wasn't done. Let me see if I can pull this down for you here. Hang on a second. Oh, that's right. This doesn't work that way. Let me just go back to that long question. I was prescribed metronidazole, cephalexin. 3rd biopsy wasn't done. Gosh, my dear Mariana, God dang. It's a little too complicated for me on a live here. Why don't you set up a short consult? Devon, higher blood pressure at 10 weeks than before transfer. Does IVF increase hypertension? Not typically, Devon. So make sure you see your OBGYNs. And always, folks, see your OBGYNs. Hello, my friend from Brazil. Okay. Ingrida Beltro. Hi, Dr. Magnus. Using birth control to keep you at baseline, to delay the baseline, does that hurt your chances of numbers of eggs? It does not affect anything, Ingrida, in terms of your body has a timer, and it will produce a certain amount of eggs in 2 waves during your menstrual cycle. And the nice thing about birth control pills, it can sort of stall the start. How long do I have to stay at the hotel before flying back home to Houston? Just the next day. You can go the next day. Are day 5 and 6 blast embryos really good? Of course they are, Amanda. Actually, I want you guys to stop using days and just using descriptions. So in other words, do you have a cleavage stage embryo, which is day 3, or do you have a blastocyst, which could be 5 or 6 or 7? That's the way to say it. Do I have a blastocyst to transfer, or do I have a cleavage stage to transfer? When home pregnancy tests should be positive after an FET. I don't recommend home pregnancy tests because they're not accurate. We do blood tests about 12 to 14 days, so I certainly would do it past that because they're not that sensitive. Sarah, my husband is having his PISA procedure on Monday. Any advice on preparing for this? Well, yes, well hydrated, avoid alcohol, tobacco, drugs, of course, during the weekend, and be rested. It is a procedure. He will be tired that day, rest the next. Kavita, hi, can a laparoscopy, hysteroscopy be done at the same time during a negative retrieval? Absolutely not. Michelle, we are looking at IVF. My husband brought up looking into IUI with donor sperm. What's your thoughts in comparison? Don't know why you're doing IVF, so I can't really answer that unless you give me the reasons. Rashani, I had a chemical pregnancy after my first fresh transfer. My TSH went from normal to over 6. Would this contribute to the chemical? Yeah, but not likely. You definitely want to have, it sounds like you might have Hashimoto's thyroiditis. So make sure you test for anti-thyroid antibodies. Brianna, in an ERA, still recommended if doing a modified natural transfer. A modified natural transfer. I don't know what that is. Sorry. Jamie, hello. Mariana, how many plasma cells need to be? I have no idea. I apologize. That's not my area. I don't do that study, so I don't know that study. Sorry. Nicole, what's a good beta for an FET when taking HCG boosters? Yesterday's with an FET of 2. Yesterday was our FET. What's a good beta? I mean, when you do your pregnancy tests, if it's appropriately timed, you know, there's going to be based on the laboratory they have a little chart associated with whatever lab you get it done, and it'll tell you what is pregnant. But again, you want to see the change in the pregnancy, in other words, doubling. Can I switch from transfer to retrieval cycle? Today is cycle day 4. Can I switch from, well, Gohar, there's no switch. A transfer cycle is estrogen dependent and a retrieval cycle is fertility meds. I'm assuming you have done IVF before, so you're getting a little bit late start. You may have to wait till next month. But contact whatever group, either the travel group or your local facility, and ask them and see if they can time it, because it's a timing thing. Sarah, my vaccine messed up my cycle, 2-week cycle. Should we push the treatment back to make sure? Yes, absolutely. Mariana, what do you advise patients about picking up their toddler after a frozen transfer? You know, you're a human being. And many people get pregnant, don't even know they're pregnant, carry kids, you know, mow lawns, work in the fields, who knows? I don't have a certain weight because it really isn't, your uterus doesn't, we just don't want you to what's called Valsalva, bear down like with constipation. You don't want to have to do that because it does create pressure. So be reasonable, but the best thing is don't carry them around. Walk down. In other words, if they're on the floor, play with them on the floor. Sherito, I have to forego this month's IVF due to ultrasound results of a cervical lesion. I have been priming almost 3 months. Should I stop priming knowing I may or may not do an IVF cycle next month? If so, when should I pick it back up? Well, yeah, you can, depending on what you're priming with. If you're priming with a growth hormone, I was actually asked this question. The good news is about having growth hormone on board, it's good for your health. So if you can afford to continue priming, great, because you're always feeding that growth hormone to the ovaries. But you want to do at least 14 to 18 days of the growth hormone prior to your retrieval. So then you just do your timing. So you could stop, but then make sure you do it at least 2 to 3 weeks before. Efficacy of progesterone suppositories versus oil. Well, all of the studies, Mariana, have been done on progesterone and oil. Okay, so that's where all the studies are. That's your perfect study. Okay. Ooh, you guys are jumping on me here. I'm way behind here. Whoa. Fail first transfer of 1-day 8-cell, grade 4. Should we try same protocol one more time before doing an I'm seeing ERA and adding my antiretroviral, or add and prime before trying again? I'm 34-8 eggs. Yes, Caitlin. Wow, all eggs. That's right. I have naturally conceived children, no tubes due to ectopics. So these are untested embryos. They're 8 cells, so they're cleavage stage, and you put in 1. With your history, I don't know how young you are. I forget how young you are, but I'm 34. Okay, put in 2. Ginsburg Newsom. What does it mean when you can get pregnant but not carry? That's called recurrent pregnancy loss. And there are a lot of factors. A lot of times it's chromosomal factors that cause that to happen. Infection can cause it to happen. Mechanical reasons can cause it to happen. Anti-inflammatory reasons, antiphospholipid antibody reasons, lots of reasons. That's what it means. So talk to the team and get yourself evaluated. It depends on how many losses you had also. Where do you time an FET around ovulation, frozen embryo transfer? It depends on, is it a day 3 or day or a blastocyst? It's just you just start your progesterone ovulation, and depending on the stage in which you want to transfer, we typically will thaw the embryos on if they're cleavage stage, grow them to blast and put them in. Alrighty, just saying, looking forward to working with you guys. Great, Holly. Thanks. Shima, what should be progesterone and estradiol level by the time of the FET? Not so much the estradiol, but the progesterone, you want it above 10. Don't worry about the estrogen so much. That's more, it's a nice supplement. There's no level that's right. We ran into this week. Hi, we have consult via phone with Atlanta on Tuesday. We are hoping to do everything in Colorado with your office. Who will actually develop my protocol if we have a consult with her in Atlanta? The person in Atlanta will develop the protocol. All righty. Why do someone get a SCH? I don't know what that is, sorry. Lauren Fields, is frozen sperm just as effective as fresh? Yes. How long would you say to wait after a natural delivery of a baby to start IVF cycle? Asking for a friend. 18 months, because hopefully you're breastfeeding. Can I prime with amitriptyline for longer than a month, Sarah? Absolutely. Hi, Stephanie. Good to see you. Stephanie King works at East Winds Acupuncture, local acupuncturist here, along with Dr. Diane Credenda, fabulous young lady. Good to see you online. Is it normal for a cycle to be so long after an egg retrieval? I had my egg retrieval in May, and cycle started the 17th, and now no sign of my cycle starting, so I can do a transfer. Well, that looks like less than 2 weeks, and that's what it should be, Megan. If you have a low AMH, are you still at risk for OHSS? You certainly can be. That's not that low, 1.9. Andrea, I've been trying to conceive for 13 years and have had 6 pregnancies that all ended in early miscarriages. That is a perfect example of recurrent pregnancy loss. All were unknown reasons, but I did have low progesterone during all of them. That's not an unknown reason. I'm using donor eggs since I'm almost 40. Is there any particular transfer medication protocols for women with a history of miscarriage? It's more, what is the problem? What is the cause? Now, it could be the progesterone. It could be, I certainly recommend acupuncture for people who have recurrent pregnancy loss. I would absolutely make sure your uterus doesn't have any lesions inside there. I would absolutely consider doing Serovital, acupuncture. And if you've had that many losses, I would get laparoscopy to see if you have endometriosis, cryptic form. Yeah. Pareen, thank you, Jessica, for all your wonderful help, as usual. Pareen, I only have one tube and we have been trying for 3 years now, so we are having a meeting next month to do IVF. I want to put in 3 just in case one can't make it. Is that okay? Absolutely not. Megan, yes, waiting is horrible. Amber, hi. Hope you're well. I go in for my second monitoring appointment for my first FET. When do you typically start progesterone and endometrium? I think that's what you mean. I'm going for my second monitoring report. Well, as soon as you're lining subchorionic hemorrhage. Thank you, Jessica. You'll have to ask that question again, whoever asked the SCH question. When do you typically start? Well, there is a schedule, and it's 6 days prior to when your transfer is that you'll start your progesterone. Those are 2 progesterones. Will a nurse do that or an RE? Kristen, you guys, I can't follow sentences like that. No. It's the doctor is going to be the one that's going to be doing the protocol development. I went back up there. Maybe I can go back to the SCH. Okay, why do someone have subchorionic hemorrhages? Believe it or not, a lot of folks with IVF do, and we think it's because of the unnatural levels of estrogen and progesterone that we use, or I guess unnatural is pharmacologic levels of estrogen and progesterone. How does referral works to CNY have TRICARE? Is TRICARE coverage, Dolores? Yes, that's you just either self-refer, but I think in the military you have to get official referrals. But yeah, it's pretty easy. Can you do a retrieval and a transfer while breastfeeding? Not likely. How can I add my regimen to prep my lining? What can I add for transfer? My first FET failed. What can I add to my regimen? I don't know your regimen. But definitely acupuncture, keto diet approach. Okay. Michelle, does embryo glue prevent ectopic pregnancies? No. Alexandra, why does an ovary not get stimulated? I only had eggs on my right and 38 years old. Well, if you had surgery, that's a reason. Sometimes it has to do with Hashimoto's thyroiditis. Sometimes it's not just the ovary, it's just simply the status of your ovarian reserve. I want to come and get testing done. Is it financeable? Misty, when you talk to our financial group, you might ask them. I don't know that. Raylene, I did PRP this cycle. Great. By the way, another nice study came out looking at the PRP infusion in the uterus. Reasonable study. It was a randomized control study. And it did show that in those folks who were at a little bit of resistance to growing the thickness of their lining, the majority of it showed that it was helpful. So I feel a lot more hopeful for using PRP in this specific situation of when folks can't grow their lining. What kind of precautions can someone take after an egg to help prevent ovarian height? Great question, Lauren. Protein, 200 grams a day, acupuncture with someone from the American Board of Oriental Reproductive Medicine or someone trained in reproductive medicine as an acupuncturist, electrolytes like Ultima, not sugary things like Gatorade, and then bed rest. So protein, acupuncture, fluids, keep yourself hydrated, and rest. I've been trying to conceived for 17 years, did IUI 3 times, Deborah. Did IVF last summer. I'm overweight with PCOS, but it's so difficult to lose weight. I'm taking vitamins. Do you recommend I try? Well, let's, Deborah, get some for everybody. In America, we have a reasonably good or high pregnancy rates for folks. It takes 20-year-olds 3 fresh cycles of IVF to make a baby, on average. It takes more than 3 for a 30-year-old and much more than 3 for a 40-year-old. So depending on your age, Deborah, it can take up to 3 fresh IVF cycles for you to achieve a pregnancy through IVF. We have to have realistic expectations as what does the science do. And it is, I know everybody on the internet, you see these ads, 60, 70, 80, 90%, we're the highest, we're the best, we're the top 10. Egg, sperm, uterus, DNA. All the rest of us are doing the same work. But egg, sperm, uterus, it's like building a track and having people race on the track. I don't care how nice that track is, but a professional marathon runner is going to beat my sorry little butt in a race, regardless of how nice that track is. So no matter how we make that track, or your uterine, your reproductive track, no matter how nice we bring your egg and sperm together, it still depends on your genetics and the genetics of that embryo. So there aren't things that make you pregnant. There are things that make it a nice track, nice landscaping. Maybe it's a covered track, so you don't have to worry about the rain. My points in these analogies is biology trumps it all. It's all about your biology. So don't get caught up in the technology. It's about the biology. And again, nature wants you pregnant. So you're not fighting nature. So why do we get subchorionic hemorrhages more than with IVF? And does it cause preterm labor? Well, the reason I said is that the estrogen and the progesterone are exogenous from outside the body. They're not from the ovary. The concentrations are different. We don't know why, but we tend to see certainly these in IVF patients. Or conversely, it's because we look at IVF patients more carefully. So we spend a lot of time looking at the uterus, whereas if it was a regular pregnancy, your doctor wouldn't even see you to 15 weeks. So by then, a lot of women would miscarry and never go to the doctors. Have had laparoscopy, I've been told everything looks good, great. Again, Andrea, sorry I can't follow your question because you probably asked it up top there. So you're trying to figure out why there wasn't an implantation, and if it was laparoscopy, good, looks good. I'm not sure what that means. Probably you don't have endometriosis. So endometrial receptivity assay, chromosomally tested embryos, do the inflammatory protocols, level 1, 2, 3, 4 level. Those are things you can do. Amber, have had laparoscopy. Okay, right. Misty, is the whole down payment due? Hi, Dr. Kelly. Glad you joined. If you have any questions, happy to answer. I'm Dr. Magarelli from CNY Fertility. Hello. That's on Instagram. Misty, is the whole down payment due before any procedure such as IVF? Well, the down payment is due for any procedure, although I don't know anything about the financial side. So definitely call financials. Yes, sir. Progesterone and oil. Thank you. See you and your wonderful team next week, Amber. Great. Third time is a charm. Absolutely. We'll be praying for you. What increases the quality of eggs and healthy lining for a 37-year-old? Well, growth hormone, Omnitrope, has been shown to improve the outcomes in folks with low quality eggs. There is some suggestion that DHEA can contribute to that. Acupuncture has been shown to improve pregnancy rates, which may infer that you're getting improved implantation. Avoiding alcohol, tobacco, drugs in both partners, guys, males and females, lesbian couples too. Nobody smoke, nobody, no drugs. It's just they have an influence. You're welcome, Dolores. Can you plan frozen transfer for a certain date? As best you can. Yeah, you can try. No one. Michelle, I answered that question. Does embryo glue help prevent ectopic? The answer is no. Jasanka, should progesterone be supplemented if under 10 and early? Absolutely. It was still within normal range for the first trimester, but resulted in an early miscarriage. Yeah, above 10. You definitely want it above 10. Jessica, more than likely the person you do your consult with. Thank you, Jessica. Perrine, praying for you. I hope you are not too stressed. Sending hugs. I don't know who you're talking about, but I'll send prayers too. Does keto help with endometriosis? Keto is an avoidance. Let's really define. Nobody's in ketosis. No one's doing keto. What you're doing is reducing your carbs to approximately less than 50 grams of total carbohydrates a day, with the idea that carbohydrates cause inflammation, excess weight gain, uh, uh, um, issues related to your heart, to blood pressure. So what you're doing is creating a healthy eating habit that reflects our natural diet. And can that help endometriosis has not been studied, but certainly inflammation is a big part of endometriosis. So it may help. Can a C-section scar affect how successful a transfer will be? No, Lauren, not likely. Stark, does using egg donor is always successful? Absolutely not. Pretty girl. Dr. Mack, how can I get into my patient portal for CNY? I got in there 2 weeks ago when I spoke with Dr. Kills, but now it's not giving me the option. I don't know anything about that, pretty girl. You'll have to call the 800 number. Protein negative, thank you. Is AMH of 20 indicative of PCS? Yes. Anything I can do to help with that? Well, when you're going through IVF, you want a low, slow protocol, Becca, which means you want low dose medications. You want to do it longer, and you want to be aware of the fact you could get ovarian hyperstimulation. And so increase your protein, electrolytes, rest, acupuncture. Melanie, for gender selection, we absolutely need to do frozen transfer next cycle after retrieval. Melanie, gender selection has nothing to do with fresh or frozen transfers. Hi, Julie Lamb. Good to see you. I got a kind of a doctor channel going on my Instagram over there. We do a lot of stuff on Facebook and YouTube. Just so you guys know, on the Instagram world, it's really hard. We have this one program called StreamYard, and Instagram for some reason doesn't integrate. But anyway, if you have any questions, just jump on. I'm doing questions and answers on this side. So in gender selection, you're not getting gender selection fresh or frozen. You're getting gender selection from doing pre-implantation genetic testing on your embryos. Well, in order to do that, you have to biopsy, then freeze the embryos and wait 3 weeks for the results. So yes, you will be doing a frozen embryo transfer in that circumstance. Eric, 35 years old, AMH 0.7. Was going to have a diagnostic scope on Friday, but got canceled due to my lower AMH level. That doesn't make any sense. Is there still hope for a sexual? Yes. Can you be successful with an AMH of 0.7 and an FSH of 10? Absolutely. At 35? Absolutely. Yeah, I don't know why anyone would cancel your laparoscopy. Is there still? Yes, there's still hope. Yeah, your consultations aren't until September for IVF. Yeah, don't be without hope. No, by no means. Caitlin, how many days from cycle day 1 to FET? 17? 17 to 19. That's usually the case. Malena, for gender selection, we absolutely need to do, we already said that. Any update on Sarasota office? Yes, we're hoping that, Erin, that we will start seeing basic patients in January. Basic patients, not a full-fledged IVF center. Ashley, is 11.6 thickness too much for transferring? No, that's gorgeous. Good job. Madeline, any hope for a 48-year-old? Okay, so a 48-year-old, there's hope. Let's make sure we check your AMH, make sure you have some indication that if you're having menstrual cycles, IVF would be your best chance because it's a time phenomenon. And that's what all of our treatments do, folks. We don't make you pregnant, we just get you there faster. That's what IVF, IUI, surgeries even. All of these are geared towards getting you there faster, but your rate of pregnancy is associated with your biology. Brandy, I have only got 3 day 3s from my first cycle, 1 good, 1 fair. Okay, too much stuff. Did I? Okay, I'm not, Brandy, simplify your question. I don't need the details. Did I ovulate them out? Yeah, there's too much words. What should the uterine thickness be, Shima? Above 6 millimeters and trilamina. Melanie, for gender select, okay. This is like 6 times I'm getting this question from you, Melanie. I don't know what's going on with you, but the answer with that is yes. Maybe that's simple. The answer is yes. You have to do a frozen embryo transfer for gender selection. Maybe that's a quicker answer. Okay. Let's see where we're at here. Do you recommend any testing after the first failed FET? Embryo was PGG tested and was normal. Assuming you're, I can't assume. Let's say you're less than 35. I do like to do, if you fail a chromosomally normal embryo and you fail your embryo transfer and you haven't had an endometrial receptivity assay or ER-peak, I do recommend you do that because those are precious, well-earned, chromosomally normal embryos. I would do that. Brandy, I had 15 follicles and 7 eggs, and you stemmed 7 days. And Brandy, just tell me how old you are. Has CNY considered offering calcium ionophore for oocyte activation? No idea, Kim. Do you recommend an ERA for first-timer under 35 for chromosomally normal embryos or that's okay, Melanie. It's okay. I just kept seeing that question come back, and I didn't know what I was doing. So 35 years old, and you had 50% of your follicles have eggs. That's pretty darn good, my dear. That's pretty darn good. Nothing to do, nothing to worry about. Oh, my pleasure. My pleasure, Deborah. You guys are great. I mean, asking questions helps me understand what you're thinking. And don't be afraid to ask any questions. I may be sure to give you a short answer only because there's so many questions. And of course, we're always available to set up a consult. Happy to talk to you guys, about that. I'm 34. Is there a difference between ERA and ER-peak? No, they're the same, Susie. One is by iGenomics, one is by Cooper Genomics. See the word genomics in there. That just means they're testing genetics. They're a genetic testing company. I think it was iGenomics invented it, the ERA, and now Cooper Genomics is doing ER-peak, whatever you can get cost effectively. Sarah, hi, La Medina. On the ask questions if you guys have questions. I think you can ask questions. So happy, and I'm sorry, I'm not a Spanish-speaking person. So if you're asking me questions in Spanish, that's not going to work for me. How much in advance would we know when to come in for egg retrieval? How much in advance? It should be on your calendar. It should be in the calendar, at least 4 weeks ahead, the month before. But again, that's not going to be your date. That's a guess. Nana, when to start estrogen patches when planning doing flare Lupron protocol? Not sure why you're doing estrogen patches in that scenario. How long do you usually stim for? It's usually 10 days to 11 days. And what determines how long you have to stim is basically the size of the follicles. You want a mean diameter of 17, 18, 19. And you want your estradiols, to be around at least 1,200. Brandy, I added growth hormone and increased my follistim. Anything else I need? Letrozole, doing acupuncture, keto. No, it's Serovital. Serovital. That's something you can get at Costco. It's a growth hormone secretagogue. It's very inexpensive. I take it because I want to get young and stay young, but it's great. Couldn't kidney stone infection interfere with IVF? Absolutely. Get that taken care of. Or is that infection or interfere? Well, talk to if it's not inflamed, likely not. Faria, 39, first consult on the 27th. How many months to go for actual procedure? Usually 6 weeks. Bobby, I have a true umbilical hernia. My doctor said it was not serious. Can I move forward? Yes. Hi, doc. Does silent endometriosis affect implantation? Yes. And A quality, yes. Jasenka, is there a natural way to increase progesterone? No. Nana, 2 days before, a little scan that will let you know when to trigger an ER is 30. Oh, yeah. Yeah, someone's answering you. Okay. Sarah, my question was in English. I'll repost it in case it didn't come through correctly. Should fibroids be removed before transfer? No. I'm talking about Instagram, Sarah. I didn't get a Spanish question. If yes, how long before transfer? Oh, 4 to 6 weeks of healing. And yes, it should be removed if it's interfering. Okay. Can breastfeeding lower AMH results? No. Mary, yes, that would be your best option. Okay. All righty. All righty, you're answering questions for me. I love it. After doing Orilissa and letrozole protocol, my period is delayed and has no sign of showing up. Wait it out? Well, I would come, Elizabeth, I would go in and get a baseline ultrasound and see what the lining thickness is. My guess is waiting it out will be fine, but just ask to get a baseline ultrasound. Lauren, my pleasure. So Julie or Dr. Atta Kelly, La Medina, if you have questions, happy to answer them on that side of the world. Elizabeth, lining was thick. Yes. So it should come. If not, ask to get a progesterone shot, and that can bring your period on. All right. Everybody's thanking each other. I like it. Oh, I was going to talk a little bit about consents. It is critical, guys, that you know what you want to do long before the retrieval. So if you want to do IVF, if you want to do assisted hatching, if you want to do day 3 transfer, if you want to do day 5 transfer, if you want to do embryo glue, if you want to do ICSI, if you want to do PGTA, PGTM, get those consents at least 30 to 45 days before completed. And those are critical. We have to know what you want. And if you haven't been asked, then you ask, when do I do my consents? When do I do my consents? When do I, this is what I want. Put it in writing. Get it on the portal. Make sure someone answers you on the portal, because just sending a message isn't enough. So there's lots of things you can do to take charge and make sure you're getting, the procedures you want. I did 3 egg retrievals so far. Second one was Duostem. So, Nano, you probably have low ovarian reserve just based on what you're saying here. Yeah. And so that's probably the issue. Hi, Chrissy. At what point in the woman's cycle does a frozen embryo transfer occur? 17 to 19 days in her cycle. Did he say own egg versus donor by chance? I don't know. Can you transfer 2 PGS tested embryos? Not likely, Lauren. My AMH is 4.5. No, that's a really good AMH. Yeah, not enough information for me to think of what the issue may be. Why do FETs fail when PGT tested them? Oh, this is a great question, Chrissy. Well, because all we're testing are the chromosomes. Hi, La Medina, acupuncturist. Just, okay, so you're here to learn. Happy to teach. And that's why I say the questions, so that you guys can hear the answers. But if you want to go on our CNY Facebook Live or our YouTube Live, you can actually see the questions coming in. So when you do PGTA testing, what's happening is you're essentially, I think of the chromosomes as office buildings, and there's 23 of them in humans, 23 pairs. And I think of the offices in the office building as genes. We're only testing if the office building has 4 walls, a ceiling, and a floor. We're not testing anything about the genes or the offices inside the office building. So just because the embryo has the normal house, has a normal structure, a chromosome, does not mean that the inside is livable. So that could be a reason. The timing could be off, Chrissy. In other words, if you've done an endometrial receptivity assay, so that's something that might help with timing. There may be some other factors in Western medicine we don't know. Acupuncture, that's something you can do. If I want twins but not identical, is it possible with IVF? Absolutely. It can happen. Any way to increase your AMH? Absolutely not. AMH is a gas gauge that measures the number of eggs in your body, and therefore you lose 1,000 eggs every month prior to age 35, 10,000 eggs after age 35 per month you're losing. It's a gas gauge. I can break the gauge and make the gauge empty and push it as full, but it still emptied the tank. My only embryo was a poor grade. Have you seen success? I don't grade, Angel. It doesn't mean anything, the grade. I've said this every lecture. It is not correlated very well with outcomes. Just, is it alive? An embryo inside you is better than one in the trash, so put it in. For a 48-year-old, wow, the questions are coming. Okay, Madeline, he did not say don't over. Okay, what happens to the embryo when it fails? It just gets absorbed. In other words, the body takes the protein and whatever it's made out of and recycles it. Angel, only embryo left is poor grade. Dr. Kills looked over it again and said he thinks it's good, not so much poor. Absolutely. A living embryo is a good embryo. There's no good or bad. It's just grading is an art. It's like the Miss America contest. Please don't believe that just because a woman wins the Miss America contest, you want her to teach at the university. It's just not the same thing. One's the book cover, one's the pages inside a book. How can you increase fertilization rate with ICSI? Well, that is how you increase it, is putting the sperm inside the egg. But the key issue is sperm health. Alcohol, tobacco, drugs negatively affect the sperm health, and ICSI is not going to override that. So if your husband smokes, does marijuana, does drugs, drinks a lot of alcohol, doesn't take his vitamins, not healthy, there's nothing, no procedure is going to get over that. Do you recommend a fresh day 3 transfer for a 43-year-old? Yes. Lauren, with a day 5 or 6 blast, how many weeks pregnant are you on transfer day? It has nothing to do with whether we put the embryo in. It still goes from your last, the day of your last menstrual period. So that's the standard. That's kind of the standard. There's no differentiation between natural conception and artificial conception in terms of how many weeks of gestation or how pregnant you are. Okay? It's the same for everybody. All right. So again, make sure you guys get all your consents done. Make sure, and you talk about them real early, and you talk about what procedures you want. And changing your mind is very difficult on the embryology team, very difficult on the nursing team, very difficult on the financial team. And every change that you do to your protocols has a fee associated with it. So have as much information up front that in terms of what you want to do. Read the boards, but figure it out. Read the family building guide. All of our options are there. Figure it out. Bring it to your first appointment. Okay. We only had one embryo fertilized with ICSI. I'm wondering how we can increase our odds with IVF cycle number 2. Change or fix the sperm is the only thing we can do. Now, it might have been an egg issue. I mean, how many mature eggs did you have? Is mini IVF safer for an AMH of 6? Safer. Great question. I don't think of safety. I think of control. A mini IVF may be too high, maybe too much for you, depending on your age. So again, the word mini has no meaning whatsoever. It's just a terminology that we, in America, call the Europeans what they were doing mini, and that's it. It's not a scientific protocol. It's a shorthand protocol, but it's not a scientific protocol. Can you do ICSI with frozen sperm? Absolutely. So Tara, had 6 mature eggs, 1 fertilized. Okay, that's low. So I would look at the sperm issue for sure. Talk to your doctor about the possibility of maybe, again, I don't know enough of your history, but the health of the male is critical if you had 6 mature eggs. I don't know how young you are, but that's low. So I would definitely see it as a sperm issue. So look to acupuncture for the male, Serovato for the male, CoQ10, folate, zinc, iron, not iron, a multivitamin, folic acid or folate, Vitamin D3 for the man. Avoiding alcohol, tobacco, drugs. Those are all the things that you can do. 29-year-old, approximately AMH of 3 is reasonable, Maritza, to have. But again, each of the AMH companies, okay, Brandy, 7 eggs, only 4 mature. What do you mean only? Is that low? Could we have not stimmed long enough? Well, again, Brandy, I don't know how old you are, but that's better than 50% are mature. We like 70%, but again, it's an odds thing. Can you grow eggs too long? Yes. Yes. So you have to balance. And if it was your first IVF, we tend to look at your first IVF and see if there's ways to improve it. Maybe, I don't know how many days did you stim? I guess I don't know that either. So can you tell me how many days you stimmed? Can I do hysteroscopy at the same time as in Colorado? Yes. But you better, like again, Christy, same thing. All of this has to be, yes, Brandy, you can go another day, probably. Well, you get on the horn to the Colorado office and see if they can arrange it. You've got to have all of your stuff planned before you start your stim. Guys, well before your consents or procedures, whether you want to do HCG boosters, whether you want to do PRP, whether you want to do intralipids, whether you want to do, you need to plan ahead, and it's all listed in the family building guide. So get in touch with Christy, the office, and again, folks, 8,000 phone calls a day, 80,000 requests for help every month. The portal is your friend. So get on the portal and or contact us with that 800 number call center. And shout out to the call center; those guys are heroes. Okay, good, Christy. Thank you. That's very helpful. Yeah, the more time you give us, the better. How long after egg retrieval can I schedule my laparoscopy? Laparoscopy with the risk of OHS. Okay. It's probably going to be 4 to 5 weeks, Johanna. Susie, planning to do another FET right after failed cycle? Have 3 PGD, anything you would recommend? Absolutely. Endometrial receptivity assay. Endometrial receptivity assay. You're doing the acupuncture, serovital, growth hormone. Yes, Brandy, thank you for saying that. We have over 400 people who look at that portal and only 40 people on the phone, so it's always better to do the portal. Can Lupron prior to stim help with endometriosis and egg quality? Again, egg quality is, ask your mom about egg quality. It's based on her X chromosome and how you live and whether your husband smokes. I mean, that's what egg quality depends on. It's your DNA, it's your lifestyle, and it's whether your partner is a smoker. Or you're a smoker, of course. So does it help with endometriosis, Lupron? Of course. What is the difference between Lupron and HCG trigger? Very different mechanism to get your ovaries to ovulate follicles, and they're 2 different mechanisms. So by using 2 different mechanisms, Tara, to get you to ovulate, you may get an extra mature egg or 2. I like it. However, when you use HCG, you increase your chance for ovarian hyperstimulation. So, that becomes a problem too. So I am kind of drifting back for double triggers for folks with Lupron and HCG after age 35 because they have lower risk of ovarian hyperstimulation. And for younger folks, pretty much sticking with maybe 1 or 2 triggers of Lupron. So we got to be careful about ovarian hyperstimulation because that does have a negative effect. Maritza, low ovarian reserve at a younger age can be genetic. Yes, it also could be Hashimoto's thyroiditis. It could be based on surgeries that you have. It could be based on infections that you've had, trauma. Yeah, There's lots of reasons, but genetic is certainly one of them, and that would be based on your mom's X chromosome and whether or not you have any deletions of your portions of your X chromosome. So yeah, it's kind of run by the X chromosome. That's kind of the place where it happens. Alrighty. So make sure you guys decide on what protocols, download our family building guide, read it, look at the options, ask your friends on social media, but know what you want to do long before you come and see us. I'm taking a mental health break since March, Mandy. I'm waiting until August to do another transfer. Should I get another saline sonogram? If it's been more than a year, yes. Or you may even want to do hysteroscopy because it's the gold standard. Hey, Caitlin, what causes hydrosalpinx and tubal ectopics? Well, usually infection for both. Ziomara, the embryo is good quality for transfer with PGT. Again, the PGT tells you more than the quality. Tells you the quality. The grading doesn't tell you the quality. Maritza, motility. I don't know what that is. So Ziomara, having a PGTA chromosomally normal embryo, this is how good that information is. The grading, this is how good that information is. Teeny weeny value, PGTA, huge value in terms of what it tells you about that embryo. So chill out. If you got a PGT normal embryo, fantastic. Fariha, my husband smokes cigarettes once a week. Is it still a problem? Is smoking smoking is smoking? Okay, smoking is smoking. I don't care if it's once a week, once a day, once an hour. Any toxic is not a good toxic. What is the procedure you will be talking about that increases FET odds? Oh, endometrial receptivity assay is where you do a mock embryo transfer cycle, and instead of putting an embryo in, we take tissue out and we send that for genetic analysis. Look it up, endometrial receptivity on the internet, ERA or ERPeak. Yes, Caitlin, yes, please consider doing the antimicrobial protocol. Can acupuncture help improve low sperm motility? According to the acupuncturist, yes. Do you have to get a hysteroscopy every time you start a new transfer? Absolutely not. I'm 31. I will be 32 next month. Can I do IUI? If your tubes are open, of course you can. Alexander, what is the best way to do a transfer, fresh or frozen? There isn't a best way. They both work, but there are reasons for do one versus another. All right. 3 sections, tubes tied. Pretty girl. Well, if your tubes are tied, you can't do an IUI. No. You don't have tubes. When they say tied, they may not be repairable. And if they do repair them, they may not help you. Alexander. The difference is fresh means is that you get your retrieval, do it 2 or 3 days later or 5 days later. Frozen means you make the embryos, you freeze them and do it in another cycle. And if someone has too much estrogen, then they have to do it the next cycle, so they freeze it. If they have too much progesterone before the fresh transfer, then they can't do it. So if you guys look at your progesterone levels, if your progesterone levels on your last blood test prior to the retrieval is above 1.5, we're not going to recommend doing a transfer. So don't be surprised. Look at your labs. If your progesterone is over 1.5, do not put embryos inside your uterus. It's like throwing away your best embryos. Don't do that. Cycle day is frozen embryo transfers. Cycle day is 19, 20, or 21 of your cycle. But again, it's not a natural cycle. How many sessions of acupuncture are recommended? At least 9. Lee, it's based on the Credenda Magarelli Acupuncture Protocol, CMAP. Go to eastwindsacupuncture.com and look at the research. It's called the CMAP procedure, CMAP. Susie, if I do ERA, does it mean I have to skip a month? Yes. Oh, of course, Susie, of course. My goal is to give you lots of answers. My pleasure. I have stage 4 endo, and I get a lot of pain with, should I do? I don't have infection. This always happens to me. Well, what should you do about the pain or pregnancy? Get rid of the pain if you can, either through medications. If it has to do with pregnancy, then you have to balance another surgery versus your next step. Lee, you're welcome. Madeline, for advanced age, are you able to try with own eggs IVF, and does losing weight? Well, Madeline, you're asking a lot of questions in that one. Advanced age, I don't know how old you are, so tell me how old you are. Number 2, at CNY, we really let everybody try as long as you have some indication you have eggs and you understand the risks and benefits. So yes. Does weight affect IVF outcomes? Absolutely. Every study shows that if you carry excess weight, you reduce your outcomes. So yes, we've certainly taken care of Madeline, 48-year-olds, absolutely. And try with your own egg. The acupuncture at CNY Albany is the best I've ever had, and I've had a lot. Pair with your monitoring appointments makes it easy. Brandy, great. Thank you for that. Angel, how many sessions of acupuncture would you say it recommends before a frozen embryo transfer? It's about 8. Also, should we continue after pregnancy? Absolutely. Good data for maintaining pregnancies, reduced miscarriages, reduced ectopic pregnancies. Acupuncture, remarkably in our studies, reduced ectopic pregnancies. What is the ideal weight to be during an egg? There is no ideal weight, Lauren. There isn't. That's not what I'm inferring. The question she asked is, if you have carry excess weight, is that associated with lower pregnancy rates? Yes. And more miscarriages? Yes. But it doesn't mean you don't get pregnant, and it doesn't mean you shouldn't try. You know, some centers push people away because of certain weights. We do not. I ended up with Marlena. I ended up with 6 embryos. None are being tested as I was told my age I shouldn't have problems. I don't know how old you are, Marlena. Is it possible to transfer 2, or are you set more on 1? Tell me how old you are, Marlena. Holy mackerel. The time is flying. This is fun. Marlena, quick, tell me how old you are. If you're in your 20s, we want you to put 1 embryo in. Marlena is 20. There you go, 1 embryo. Yeah, because the goal here is 1 healthy baby at a time. I've certainly put in 1 embryo and gotten triplets. I put in 2 and gotten octuplets. Not a good thing. At 4 laparoscopy, 4 is too much, Caitlin. No, that 4, that doesn't make sense. To have 4 laparoscopic surgeries, something's not making sense. And if you want to set up a consult with me, and we can discuss this, but that's not making sense if you had no diagnosis. Does bicornuate uterus with no septum change your FET protocol? Well, you certainly only want to put 1 embryo in. Marlena, my pleasure. All right, guys, we've done it. Oh, 3 were ectopics. Okay, thank you. Not necessarily, Caitlin. Not necessarily would they have. Well, they may not have looked for it when they're taking care of an ectopic. Okay, so, and I don't know how many years ago it was that you had these ectopics, but it's just another option for why a person may not have implantation. It's not the answer. Typically, they would tell you. Well, okay, folks, another wonderful hour that we spent together here in kind of cloudy Colorado Springs. We're growing, folks. We're growing. We're so appreciative of you guys and all the love on the lives. And I love when you guys say hi to me and say, hey, I saw you on Facebook Live. I mean, we really love that. That makes me and my team actually loves it too. They feel really good when you say, "Hey, we saw Dr. Magarelli on Facebook Live," and that really makes them it makes them excited. So make sure you tell our crew that you've seen us here. Um, Again, my goal. Thank you, Caitlin. My goal here is to try to get you through this forest of information and get you on a path, and just get you on a path to making that one healthy baby. The goal is one healthy baby. The goal is to work as a team. The goal, just support each other, support my team too. I'll tell you what, we have gotten so crazy busy and we apologize. We're a victim of our success. So I always say thank you to my poor team. They're working like dogs, because we really have, we started with about, 300 cycles a year. We're now at about 1,800 and we're growing astronomically. So they're tired, that doesn't mean we don't want to take care of you, but sometimes a smile from you guys really goes a long way. And we really appreciate you guys, bar none. Next week, I haven't picked a topic. I don't know. I'll think about it. I hope I'm not going through the questions too fast for you guys. I want to make sure I'm answering all your questions as best I can. And again, the portal is your friend. Acupuncture is really helpful. Removing alcohol, tobacco, drugs, it's super helpful. Being fit, super helpful. Healthy body is a fertile body, super helpful. Sooner is better than later. That's helpful. So anyway, you guys be well. Really appreciate it. Have a wonderful evening. I'll talk to you guys next week.